This story is sponsored by Little River Medical Center. Well, everyone, it is a beautiful day here at the Carolina Forest location of Little River Medical Center. I'm joined by Catherine from Little River and Stephanie from SC Thrive. How are you ladies doing today?
We're doing great.
Great. Oh my goodness. We are spoiled with this weather, but let's jump right in.
So nice.
What are we talking about today?
Well, today we're going to be discussing SC Thrive's partnership with Little River Medical Center and how we utilize that to bring food access benefits to not only our community, but our patients.
All right, Stephanie, tell me a little bit about SC Thrive and what you guys do.
Sure. So SC Thrive is a statewide nonprofit. We really help South Carolinians access social determinants of health and resources that really help their whole person and their families. And so one of the things that we do is partner with great, wonderful organizations like Little River Medical Center to help their patients access the SNAP program, Medicaid, and other programs that can help stabilize their families.
I think it kind of goes without saying, but this is definitely a need here in South
Absolutely.
Carolina. Definitely a need here along the Grand Strand. Where are we seeing these resources go to work?
So we're seeing a lot of individuals out in the community coming into a lot of our sites. Of course, we have 6 sites located throughout Horry County, and so it's really accessible for people to come in. They can either come into a location or they can call one of our outreach team members. We actually have 7 that are available to provide the SNAP benefits, help with enrollment, help with the application process, and really actually through SC Thrive's Thrive Hub system, they can submit it electronically to really help speed up that process in determining eligibility.
All right, Stephanie, tell me a little bit about what you do.
So I'm the Chief Development Officer for SC Thrive, and I get a chance to work with wonderful partners around the state to help them identify what their needs are of their clients and then institute or implement Thrive Hub in their daily workflow. It really helps to save time, remove the administrative burden of the state agency as well as the organization that we're working with, and most importantly, help the whole client.
All right, so what do people need to know if they want to get started?
Yeah, the first thing that they can do if they want to work with Little River Medical Center is they can call one of our outreach team members at the number that you see on your screen. We also have bilingual staff members available, so that's a huge perk that we offer. They'll come in or over the phone. Our eligibility team will actually screen them to see what all benefits they might be eligible for and help them work through the application process. And again, we're able to do that through SC Thrive system.
Awesome. And how does it feel whenever you're able to see people get those benefits that they really need?
It's extremely just positive for us because we know we're making an impact not just in our communities but for families statewide. So it's really important.
Love it.
One of the other ways that we're able to bring this out into the community is we do a lot of partnerships with churches, other organizations, other nonprofits. So any events that are happening in the community, like food distributions, food pantries that are open and available, we're also able to go on site and provide that access to the Thrive Hub system to complete those applications electronically or just pass out SNAP materials, give out information, give out little goodies to share more about what the program is, what benefits someone could really have access to, and what it potentially means for them and their families, and having access to food resources in our community.
Love it. Okay, I wanted to go back a little bit and dive a little more into the actual ways that we are helping. Is this really just for people that don't have enough food or don't have access to food? Tell me a little bit more about that.
I'd say so both. People don't have, when you're food insecure, you may not be able to have access to food. You may live in a food desert where the closest grocery store may be 20 to 30 miles away. You may not have transportation, and that's a huge burden and a barrier. And so having that food access is essential, but then not only that, having the ability to apply. Sometimes people don't know how to apply. The application process can be cumbersome and confusing. And so to have assisters in the community.
This story is sponsored by Little River Medical Center.